Hello, and welcome to ASL Proficiency and Improving Healthcare Outcomes for Deaf Patients. This website was made to raise awareness and to encourage ASL to be incorporated and implemented in the healthcare system. So, first, when you click on this website link, you are navigated to this home screen right here. These tabs right here, labeled About Me, are tabs where you can go and learn about me and the creation of this website and its purpose. Moving down, there are two peer-reviewed articles here. One about the intervention aimed at improving healthcare and health education, equity for adults and adult and deaf patients. This is a systematic review. The other on the right is the barriers and facilitators of health literacy among deaf individuals. This is also a review article. Moving down, we have two different YouTube videos. One that highlights the obstacles of having a different language communication with your doctor. In this case, ASL. And then the other is an ASL video that summarizes the findings of the patients with and without hearing impairment attempting to obtain primary care, medical, and dental appointments. Then we have three different peer-reviewed articles. Deaf patients' preferred communication in clinical settings, examining the intervening roles of patient-centered care and patient advocacy, and what deaf sign language users experience as patients in healthcare services. This is a scoping review. Moving down, we have two more YouTube videos. One is a AZCDHH deaf specialist talking about how to ensure effective communication with deaf patients to stay compliant with the ADA. And the other explains how healthcare workers can take care of deaf and hard of hearing patients to ensure proper communication and therefore ensure better quality of healthcare. Here I have 5 additional articles. These are non-peer-reviewed articles. They speak about different things, implementing sign language in healthcare, how crucial it is, and the role of medical sign language interpreters. Here we have 2 more videos. One is a news video about a deaf patient suing for the lack of an ASL interpreter, where the other is a sample interpretation of how some doctors discriminate against patients with disabilities. This does include hard of hearing and deaf patients as well. So moving on to the actual project. So in Tampa Bay, what can we do in Tampa Bay to ensure that deaf and hard of hearing patients have full access to healthcare with no limitations negatively impacting their care? So here we have 4 different steps and different parts of this project. So the first one is on-demand ASL interpreting and VRI services at local clinics and hospitals. So these services already exist in Tampa. An example that I have hyperlinked on this website is Purple's On Demand 24/7 on demand ASL interpreting. It's just an example of many of the services that can aid in implementing ASL in healthcare, specifically in Tampa Bay. The second is staff training and deaf awareness. So, by working with doctors, nurses, PAs, and other healthcare workers, we can encourage many to take the step to learning ASL through online or in-person workshops and just learning more about deaf culture to ensure better healthcare for deaf patients. Third is at the Deaf Patients Advocacy and Navigation Program. So since this project is for deaf and hard of hearing individuals, we have to listen to them. We have to listen to the community. We have to know if what we're doing is a positive impact on our community. So by providing a hotline and website where people that are part of that community can communicate their any adjustments that they might have, comments and concerns. The fourth is accessible patient materials, sign language, health, education content. So the last part of this project would be making informational materials more accessible through videos in ASL and subtitles to ensure that deaf patients are getting the resources they need for their health and well-being. Moving down, these are our resources and sources that helped create this website. And here is this where this video is available.